Hello everyone, welcome to Quick Hacks for Homeopaths. Today we are going to discuss a very important topic. I am assuming that some of you must be practicing for quite some time. Some of you may be newbies into clinical practice. So this video is made with an intention to give you some points of precaution and warning while applying our medicines. Because if due to ignorance or unawareness we do not take these into consideration, we may end up make irreversible changes in our patient, and then later it will be a state of confusion for us also and also for the patient, that why the results are not coming or why they are getting worsened. So this is a compilation from all the literature available, and I'm going to give you key points for the remedies so that this video can be really valuable to you. Whenever we prescribe a remedy, we try to see incompatible or inimical remedies whenever we are following up the case. But there are other all important cautious points given to us, or points of precaution, that I am going to compile in this video. You might need a pen and paper if you wish to note anything. So let's dive into this. Let's start with acetic acid. Now acetic acid usually given in medium potency like 30 or 200. This is a point of precaution that it should not be repeated often, because out of habit if we repeat it, it may cause really bad changes in the patient. The next remedy is belladonna. Now the first precaution is, do not give this remedy when symptoms have been for days. If it is for few weeks or days, do not think of belladonna. And do not give it in low potency to breastfeeding mothers. Do not give it in cases of acute glaucoma or duodenal ulcers. It can really worsen the inflammation. Now aconite, very important remedy for clinical practice. Do not think of aconite in fever which bring out eruptions or intermittent fevers. Even in the skin diseases, if you are trying to think of aconite because of the panic state or something like that, if the patient, only if the symptoms are appropriate, there is really high anxiety and high fever in the case, only then think of aconite. Otherwise it is not given in fevers which bring out eruptions. Allium cepa. Allium cepa should not be given in high potency if we are not sure, because in higher potency, if it is repeated many times, it can cause dyspnea to the patient, especially asthmatic patients, and also it can draw the whole complaint to the chest. So the upper respiratory becomes lower respiratory, and we think that the disease has progressed, but it could be because of allium cepa. Next remedy comes apis smell. Now apis smell should never be thought of in pregnant females, especially early months of pregnancy, because it can really produce risk of abortion in these females. Arnica. Arnica is a remedy, we all know this, never to be applied as an external application. Whenever there is any abrasion or any cut, or the skin is broken or the wound is open. Why? Because arnica will give out a very bad erythematous eruption in that area. Also in cases of burn which develop fever, never think of arnica. Instead give aconite. Next comes arsenic album. Now arsenic album is a remedy which should never be thought of in cases of really poor or low vitality. Cases which are critically ill, patients who are really old, or also cases which are incurable, because it can be a remedy which could push the patient to go further down the rail. Never think of arsenic album in early cases of typhoid or tuberculosis. Be very cautious in heart patients whenever you think of arsenic album. Now coming to baryta carb. Baryta Carb is a remedy often given to children with deficient intelligence. Think of Baryta Carb as a remedy to be avoided in catarrhal asthma or asthma with emphysema. Because there is a misconception that this is a remedy given in respiratory illnesses of imbecile children, but you have to remember that not just imbecility or low intelligence is a key point, but ill developed genitalia is also very key guideline to Baryta Carb. Now think of Kilkiria Carb. Now Kilkiria Carb, we all know that there is a series in remedies we all have studied: sulfur, Kilkiria and Lycopodium. So Kilkiria Carb should never be given after Lycopodium or should never be thought of before sulfur. So if you are prescribing sulfur or Lycopodium, you should check if you have given Kilkiria. Never repeat Kilkiria Carb in old patients. Even in children, we should not repeat this very often. And if as an acute remedy you are thinking of Brainia and Kilkiria Carb are inimical to each other. So be careful of these prescription. Let's come to camphor. Camphor is something which you should keep handy. It can be a very good emergency remedy. Check for perspiration. If the patient is sweating, never think of camphor. It can give fatal symptoms. Never give camphor too high potency or never repeat it very often. Wait for camphor to work. Now let's come to carcinosinum. This is a remedy where often we go and try to dug if there is any history or family history of cancer in the patient, but this is not always needed for carcinosinum. Number one. Number two, never ever think of carcinosinum in an actual case of cancer. It's going to produce a violent reaction in the patient. Please do remember this. Let's come to cholinsonia. Now cholinsonia is a cardiac irritant. So this is a remedy usually thought of in anal complaints, but take a detailed history of the case. This should not be thought of in especially low potency in a heart patient. Let's come to cretigus. Now this is again a tincture often given to heart patients. What is an additional precautionary symptom that cretigus tincture should be advised to patients immediately after meal. So please do tell your patients that take this tincture soon after your dinner or lunch. Otherwise this is a remedy which can produce nausea in a patient. Let's go to another heart tincture, digitalis. Now digitalis should be not an easy remedy. It should always be considered with caution. The first point of caution is never give this in early stages of cardiac disease, because it can create disastrous changes. It can weaken the muscle of heart and it can cause heart dilatation also. You can only think of digitalis only when there is failing compensation of heart. So don't think of this remedy in organic diseases like fatty degeneration or myocardial degeneration. And also digitalis should not be thought of in high attenuations, and the repetition should be done very cautiously. Now let's go to gelsemium. Gelsemium, if the urine color is yellow, don't think of gelsemium. Check if the patient is, usually we think of thermal reaction, we will ask whether you feel, we always try to find out thermal reaction of the patient. Gelsemium is a hot remedy, but important is that the lower extremity of gelsemium patient are very, very cold. If the extremities are warm, don't think of gelsemium. Now graphitis. Graphitis, an important remedy in skin condition. In eczemas, if the case is an antisoric we are thinking as graphitis, just do not prescribe on this basis. Think of it as a very, very key guideline symptom. If the fluid coming out of that skin eruption is not sticky, not yellow, not oozy, then if you're prescribing blindly, it's going to give a very bad, terrible itching to the patient. To confirm graphitis, always ask, do you like sweets? You can ask direct question in such case. The patient will almost always will say that I have aversion to sweets if the case is of graphitis. Let's go to HIPAA self. HIPAA self, please remember, the important caution is avoid giving HIPAA self in a closed cavity abscess or a suppuration where there is no opening for the pus to go out, whether it is in breast or ear or sinus or anywhere in the skin. You should not think of HIPAA self. In encysted tubercle of lungs, there has to be a way out for the pus, and HIPAA self should not be thought of in early stages of cold and coughs. Let's go to Ignatia. Ignatia will never have a prominent anger and violence throughout. There has to be an alternation of a weepy, sad state, and it should alternate it with anger and irritability. Avoid giving it during the night time. So prescribe Ignatia during the daytime. Let's go to iodine. Iodine should never be given externally for enlarged glands or any thyroid condition. Never ever externally. Avoid giving iodine during the postpartum period. In pneumonias, you should not think of iodine, especially in cases of tuberculosis of lungs ending up in pneumonia. Let's go to Jabrandi. Jabrandi is sometimes given in potencies and sometimes given in tinctures. Avoid in heart failure, not to be given in post-pubertal uremia, not given in adynamic organic diseases. Never think of Jabrandi in pulmonary congestion or edema because of it. Now, Kali carb. Kali carb is given usually as a constitutional remedy. But if the patient is constitutionally Kali carb and comes with a gallstone colic, but we have studied that Kali carb is a very good remedy for gallstone colic, never ever give Kali carb to constitutional Kali carb patient. Instead, think of aconite. Never give Kali carb in early cases of cardiac diseases. Never give it in early cases of consumption or pneumonia. A big, broad, bold caution is given not to give Kali carb in acute gout or advanced cases of tuberculosis. Also, Kali carb should not be thought of in true epilepsy, because in Kali carb the main symptom of epilepsy is patient will not lose consciousness. So avoid it in epilepsy. Dr. Kent has specially mentioned that Kali carb is one of the dangerous remedies if not given with good thought. Now let's come to lachesis. Now if you're giving lachesis for the first time to the patient, usually it is observed that 200 potency produce many aggravations. So try to start the case with 30 potency or 1 potency and do not repeat it often. Give good amount of time for the remedy to act. Let's go to Merksol. Merksol, the checkpoints are: number 1, check for dryness. If there is dryness of the tongue or dryness of the skin, do not give Merksol. If there is anasaka or ascites, do not give Merksol. Especially in cases of typhoid, if the symptoms are not clear, unless those symptoms are absolutely indicating Merksol, Merksol should not be thought of in cases of typhoid. Merksol should not be given in absolutely syphilitic cases of chancroid. Don't start the case with these remedy. Let's go to Natrimure. Natrimure, again, this probably everyone knows that it should not be given during the fever. or natrium should not be thought of in acute severe headache. The next remedy is phosphorus. Phosphorus is again a remedy where caution needs to be taken, especially in acute tuberculosis cases. And do not repeat it even if you are prescribing it. Do not give it in 30 potency. Always check if the patient desires salt. If the case is really of a phosphorus remedy, the patient will want to have salt in addition. Phosphorus should not be given in a low vitality state. Again, patient coming to you with really bad weakness, prostrated case, don't think of phosphorus. Pulsatilla. Again, pulsatilla, never think of pulsatilla at the very beginning of the cold or if the cough is really loose. Also, pulsatilla should not be given when the fever is really high. In very high fevers, don't give pulsatilla. Usually, the patient will be thirstless. If the patient is very thirsty, again, pulsatilla, never think of that. And most of the time, especially in our early days of practice, we try to find out if the patient is yielding. Sometimes we will ask direct question. But because the nature of pulsatilla patient is such that they will mold themselves just to make a good impression on you, so that we will like them, pulsatilla patient will mold their answers according to your questions. So don't ask them these direct questions. Pulsatilla should be very cautiously given to pregnant females. It can induce abortion. And when you prescribe pulsatilla, if there are indications, and if you are prescribing pulsatilla, ask the patient to avoid fatty food for a couple of days at least. Let's come to silicea. Silicea must be avoided in high potency in advanced cases. In cases which have progressed in their pathology, don't give it in high potency. Avoid silicea in old patients of pulmonary tuberculosis because it can cause fresh disease, especially if the tuberculosis is still insisted. It's going to give a really flare up to the case. Sulfur is again a dangerous remedy. Do not give it in high potencies in structural organic changes in organs, especially vital organs, especially lungs. And again, repetition, it is a double-edged sword. So avoid repeating in cases with rapidity and violence. This is a very important constitutional remedy, but the repetition must be given good thought. So as we wrap up, I want to encourage all of you to continue learning and growing in your practice. And thank you for listening to me. I hope this was of value to you. Stay safe and stay healthy. Thank you.